First cases of Omicron touchdown in Australia. Our top doctors are working around the clock to learn more about this new strain and whether it's resistant to vaccines.
For more on this, we're joined by Australia's Chief Medical Officer, Paul Kelly from Canberra. Thank you so much for your time. There is a growing sense of panic, isn't there, around this variant this morning. Is that warranted?
Oh, good morning, Sylvia, David and viewers. So no, it's not warranted to have panic at this stage. We're very much alert to this. The WHO has called it a variant of concern because it's a different configuration of the same virus. This is still the SARS-CoV-2 virus that we've been working with through multiple variations for the last 2 years. This is just the latest one. What do we know? Why are we concerned? Three potential reasons. It could be, is it and three specific questions that are not yet answered fully. One is, does it transmit between people, and if so, how infectious is it? We know that it does transmit. It seems to be at least as infectious as the Delta virus. So we do know it will spread. It is spreading through southern Africa quite rapidly. Second of all, does it lead to more severe illness? We don't know that yet, and there is conflicting reports about that. The 2 cases that we've had in Australia so far, it's only 2, but they've been asymptomatic. That was the same in the cases reported from Hong Kong and the reports we're hearing from Europe. But in South Africa, they are seeing hospitalisations, so that's an open question. And the third thing is, will the vaccines and treatments still work? At the moment, we have no evidence that there is a problem with either vaccines or treatments, but that's a matter for very intense research right now, and we'll look for further information in coming days and weeks.
Well, as you said, there are 2 cases in Sydney. There may be a possible 3rd case in Melbourne. We're yet to find out, though. So is it time to ramp up quarantine arrangements for all international arrivals, like what's happening in South Australia, for instance?
So we know we've had different views on that across Australia. We've had 3 jurisdictions, New South Wales, ACT and Victoria, which moved to a quarantine-free stance on the 1st of November. And so they're the ones I'll concentrate on really, because the other states have already got strict quarantine for all arrivals, so that hasn't been a change for them really. For the other states, all 2 states and the ACT made that decision to, at least for the 72-hour period since Saturday, to ask people to go into isolation at home, or more strict than that, but depending on where they've come from. So that's the current settings, and that's very similar to most of the rest of the world. In the UK, they've done basically that same thing, but concentrating very much on people from southern Africa. Same in European countries, same in the US, Canada, etc. So Israel, for example, have gone harder. I spoke to a close colleague in the Ministry of Health yesterday in Israel, and they've got their own domestic reasons for doing that, and that's their decision. But I'll continue to advise the government in relation to the risk and have that balanced approach.
It's likely we're going to see more cases of Omicron confirmed in the coming days, given 260 people were on the flight that carried the 2 positive cases. They were free in the community for a period of time after touching down in Sydney. With that in mind, what needs to happen domestically with borders? Queensland's likely to open potentially next week at 80%. Is that still safe?
Look, the domestic borders are a matter for the states to decide on, and there's very active discussion at the Australian Health Protection Committee that I chair. We've met every day. We'll continue to meet every day this week. We've met every day over the weekend. But that's a matter for them. Clearly, when new information comes, we have to take that into account. This is new information. It's a new variant of concern, but as I said, how real that concern is remains to be seen. There's been 13 variants of concern, and most of those have, at the start, been very worrying. But most of them, other than Delta, Alpha, and this one, Delta and Alpha, this one's still to be seen, have become less concerning over time. They've either been less transmissible or less severe. Or early reports that there was problems with the vaccines weren't actually warranted.
You must have some thoughts, though.
So we're in that information gathering phase.
You must have some thoughts, though, on whether it is safe for Queensland to open at 80% next week.
So that's a matter for Queensland. I'm not going to speculate on what the Queensland government may decide in relation to that.
We just heard from Dr. Nick Coatsworth before. He was just saying that, look, let's say Omicron isn't as strong a strain as Delta is. In fact, it has very, very mild symptoms. Maybe we should just let it go through the community. That actually might be a good thing. What are your thoughts on that?
Well, okay, if I was to have a wish list for Christmas, having and this is very much an evolutionary biology theoretical process, but if I was to have a wish list for Christmas, I would want a variant of the SARS-CoV-2 which was highly transmissible and would replace other versions of the disease, as is happening in South Africa, which leads to a more mild human disease. Now, if that was the case, then that would be a very good Christmas present. But we do not know that yet, for sure. And I think it's very, very much we need to have a precautionary approach now until we get that information.
So Omicron may be the gift we never knew we wanted. Before we let you go, though, how long is it going to take for us to gather sufficient data on Omicron and what it's capable of doing to people? I mean, if there is an advantage of having cases in Australia, I know that we'll, as we did very early on, you may recall, in 2020, have locally grown virus in our own laboratories, which we can then do our own tests and very rapidly get that information. Similarly, in the rest of the world, and we're very closely linked to our colleagues in many countries, that sort of information will be gathered over this week, I would say, probably on the next couple of weeks, in relation to laboratory testing of vaccine effectiveness, for example. Some of the other things about like severity and real-world vaccine effectiveness, that's going to take much longer, so there's still a lot to learn about this virus. We've only known about it really internationally since late last week, so things are rapidly changing. It is early days, isn't it? Chief Medical Officer Paul Kelly, we appreciate your time this morning. Thank you so much. Australia and the world is waking up to a growing sense of panic this morning over the new COVID variant. Omicron has sparked new travel restrictions, questions over the vaccine and major stock market drops. We're joined now by infectious diseases specialist Dr. Nick Coatsworth from Canberra. Nick, good morning to you. How worried are you about Omicron?
Probably a little less worried, Sylvia. I definitely don't think we should be waking up to any sort of panic. This thing is only 72 hours old. The Australian government's taken some judicious but measured responses in terms of closure of international flights from Southern Africa. But, you know, there's a lot we need to find out, and I don't think there's any strong evidence at the moment, apart from the fact that it's got 30 mutations, that those mutations are going to have the sort of negative effect that we think they were, the risk that they will. Yeah.
So there are only about 150 cases identified so far around the world. What do we know? What do we know for sure about Omicron at this point?
We know for sure that it's got 30 mutations on the spike protein at the area where the spike protein actually binds to your lung cells and gets into your body. And that's the concern, because that's also the place where the antibodies that you make from the vaccine act as well. So that on face value is concerning, but then you have to translate that into what happens in real life. And as you say, there's really too few cases at the moment. In fact, the South African Ministry of Health said that most cases have been mild. So there's also some positive news on the horizon as well.
We heard from the doctor in South Africa, Dr. Angelique Coetzee, who first identified Omicron and raised the alarm. She says that the symptoms, as you say, have been fairly mild so far, more mild than Delta, for example. Has the World Health Organization overreacted in calling this a variant of concern?
Not at all. There's three elements of variant of concern. It can transmit more quickly, it can be more deadly, or it can evade the vaccine. And it's the first one, because the speed at which it's spreading in South Africa is what makes it a variant of concern. But let me put this to you, Sylvia. If this is milder than Delta, you actually want it to spread within your community. You want it to outcompete Delta and become the predominant circulating virus. So that just shows you how much more we have to learn about this, because it could be that we want Omicron to spread around the world as quickly as possible.
Meantime, we don't know enough about how vaccines are responding to Omicron at this stage. Would you advise that we bring our booster shots forward, say from 6 months after the second dose to 5 or 4 months after the second dose?
Well, definitely not at this point. We don't know enough. And I guess the problem with calls like that, and I've seen my colleagues say that in the news over the weekend, is that makes hundreds of thousands of Australians pick up their phone to their pharmacy, their GP, puts pressure on pharmacists and general practitioners to do things that they don't actually need to do. So I think premature calls for action like that, when we know so little, are a little bit counterproductive, Sylvia.
OK, New South Wales still intends to relax restrictions by mid-December as planned. Is that a smart move? Is that still safe?
I think based on the information we have at the moment, we shouldn't really change our plans. The only thing that we should change is, mild restrictions on the number of people coming into the country from certain other countries. But at the moment, everything else can go on as planned. But really, we're going to learn a lot more from the laboratories, from the World Health Organisation over the coming days.
You bring us much reassurance this morning, Dr. Nick Coatsworth. It's greatly appreciated. Thank you very much for your time.
Thank you.